Madison Marshall, and today I'll be giving an informative speech about PTSD. We often hear the term PTSD and immediately shy away from the conversation. It can be an uncomfortable topic that some of us may prefer to sweep under the rug than actually talk about. I'm here today to have that tough conversation with you all. Together, we will work to understand what post-traumatic stress disorder is, how it manifests, and different ways it can be treated. To begin, what is PTSD and how is it caused? PTSD is an anxiety disorder that can occur after witnessing or experiencing a traumatic event. PTSD develops when we're exposed to events that overwhelm our ability to reestablish homeostasis, or in simpler terms, get back to our baseline. Individuals with PTSD often have a progressively dwindling stress response, which is why even the smallest reminders of a trauma can induce a full-blown stress reaction. A quote from Dialogues in Clinical Neuroscience reads, "It permanently alters how an organism deals with its environment on a day-to-day basis, and it interferes with how it copes with subsequent acute stress." PTSD can be caused by any event considered traumatic. For men, the most common causes are combat and witnessing death or severe injury, while molestation and rape are the most common causes in women. Roughly 30% of people with PTSD will develop a chronic form. Speaking in more scientific terms, what makes memories traumatic is a failure of the central nervous system to synthesize the sensations related to the traumatic memory into an integrated semantic memory. This can be a confusing concept, so I'll use myself as an example. For context, I developed PTSD after a head injury playing soccer. Following my injury, anytime I was reminded of anything related to soccer, I'd be set into a spiral. It could be something as simple as seeing an old jersey, but my brain could no longer differentiate the harmless jersey hanging in my closet from the time I was actually injured in it. I simply couldn't regulate anything tied to that experience. We'll explore this further as we discuss how PTSD manifests. Now that we understand what PTSD is, we must next study the symptoms of PTSD or how it manifests. In order to be diagnosed, a person must experience 3 different symptoms for at least 1 month, and those symptoms have to cause significant distress or interfere with their work or home life. What are these symptoms? Let's take a look. Re-experiencing symptoms. Reliving the traumatic event. Memories can come back randomly or be triggered. Reliving the event may cause intense feelings similar to those they had when the event took place. Avoidance and numbing symptoms. Efforts people make to avoid the traumatic event or triggers. Arousal symptoms. Feeling constantly alert after a traumatic event. Examples include increased emotional arousal, difficulty sleeping, outbursts of anger, and more. Example scenario. Rachel develops PTSD after a car accident. She finds herself reliving the moment of the crash several times throughout the day, causing panic attacks. Rachel avoids the people she was in the car with during the accident and refuses to get back in the car. Rachel constantly feels on edge and is having difficulty sleeping due to the nightmares. Interestingly, one study found that dissociation during a traumatic event is an important predictor for the development of PTSD. Going hand in hand, the longer a traumatic event lasts, the more likely the victim will react with dissociation. Other factors that make individuals more susceptible to developing PTSD are if they were seriously injured during the event, experienced long-lasting or severe trauma, saw themselves or a family member in imminent danger, felt helpless during the trauma, or were unable to help themselves or others, and more. There are clear biological changes associated with PTSD. Victims often develop additional disorders or comorbidities like depression, substance abuse, memory loss, and more. The course of PTSD is variable and different for everyone and changes over time. However, there are treatment options available for those impacted. PTSD can be an incredibly heavy and isolating disorder to deal with, but it's critical people know they don't have to do it alone. There are multiple kinds of therapy, including psychotherapy, talk therapy, dialectical behavior therapy, DBT, and eye movement desensitization and reprocessing therapy, or EMDR. Studies have shown that DBT and EMDR may provide benefits that traditional therapies lack. Antidepressants have also proven to be helpful. In order to help traumatized individuals process their traumatic memories, it's critical that they gain enough distance from their sensory imprints and trauma-related emotions so that they can observe and analyze these sensations and emotions without becoming hyper-aroused or engaging in avoidance maneuvers. The serotonin reuptake blockers seem to be able to accomplish exactly that. Studies in our laboratory have shown that selective serotonin inhibitors, or SSRIs, can help PTSD patients gain emotional distance from traumatic stimuli and make sense of their traumatic intrusions. Now that we have our tools, we need to analyze 3 critical steps in treating PTSD. Safety. Traumatized people need to rely on others for safety and care when their own resources are inadequate. It's critical that a victim reestablishes contact with their natural support system. Anxiety management. Naming the problems they're facing and learning to formulate appropriate solutions. Psychological interventions to strengthen coping skills can be imperative. Emotional processing. The victim needs to re-experience the event without feeling helpless. Exposure therapy is thought to promote symptom reduction by allowing patients to realize that remembering the trauma is not experiencing it again, and that the experience had a beginning, middle, and end, and that the event now belongs to one's history. While there are many resources available, it's important to note that there is no timeline on this process and recovery is not linear. Why is this also important? If we don't recognize the symptoms of PTSD, we may not realize where you're suffering from it. Likewise, if people don't know effective treatment options exist, they may not seek care that could potentially be life-changing. Learning what PTSD is, its symptoms, and treatment options better prepares us to help others and possibly even ourselves. To anyone in my audience who may be struggling today with whatever it may be, I'll leave you with this. There is no timestamp on trauma. There isn't a formula that you can insert yourself into to get from horror to healed. Be patient, take up space, let your journey be the balm. Dawn, sir. Thank you.